right, well, welcome everyone. It is time to start the September meeting for the local Alcohol and Drug Planning Committee. My name is Eric Geyer. I chair this meeting. I also work for Jackson County Community Justice. Today, we do not have a full quorum, so we won't be able to accomplish the official business to authorize minutes, but we will still be able to work through this agenda, get updates, and be inspired by so many hopeful programs that are out there in our community. However, there are still a number of people in our community who are hurting, and there are many of us on this call today who are hurting as we have lost another person that we all care for. And I would like to take just a moment of silence to honor Anthony, who lost his life just yesterday. And many of us have a lot of love for that person. So if we just take a second out of our meeting. Thank you. I appreciate that. And I know his family and friends are hurting right now too. So we do carry on though, and I'm excited about this agenda because people that inspire me daily, it's one of those things where people say, what do you do? And I'm like, oh, I work with them. Like, you know what Oasis did? I get to do some of that too. So I always try and glom onto their good work because it's inspiring and it is just absolutely what we need in our community. It's one of those shining light programs that accepts people where they're at, loves them for the person they know they can be, and is just an incredible, empowering force in our community. So again, not to set this up with too much pressure, Carrie, Kristen, Jillian, and team, but I'm really excited to have you guys here today. And I think it's just what the doctor ordered. So as we skip over committee business, I will turn it over to the Oasis Center for their presentation. Thank you.
Thank you, Eric, for that very nice introduction. We really appreciated that. So we just wanted to, I'm Carrie Hecox, I'm the doctor at the clinic, and this is Kristen Johnson, our executive director, and I think we have, is Jill on the call too?
Yeah, we've got Jill, our peer, and Hillary, our nurse midwife, Sasha, our child and family services manager, and Renee Dodge, our patient services coordinator. We are so happy to be here sharing our clinic with you guys, so thank you. Our tagline is we're more than a clinic, a community, and we're co-located with the Addictions Recovery Center. Thank you so much to the ARC. We're at 1025 East Main Street. So when you're coming down Main Street, you pull in, we're around the back side and you can see the sign there. These were on a beautiful blue sky day with daffodils. This is our waiting room, and our regular hours are Monday through Thursday, 8 to 5, and Fridays from 8 to 2. And this is our mission, which is to transform the lives of families in recovery through integrated social and medical services. And what that means to us is that we look at the family as our patient. We're working with the patient, the parent, through all the stages of recovery, and then we're also working with the child and the parents' parenting capacity, and just really working to heal the whole family and to support them in their success with social supports, medical care, mental health care, and just through their whole journey. Yeah, we opened in 2019. And we're really a medical home for families that are affected by substance use disorders. We provide pediatric care, prenatal care, primary care services. We're really a family-centered agency, so we encourage parents and caregivers to bring their children to their visits, which is, kind of unusual for a medical clinic. But as you'll see in just a moment, we have a really fantastic family room and provide some great family support services. We all work together as a team to really integrate the care and work as a care team to provide all the services for families. And this all happens within non-stigmatizing, non-judgmental, really supportive environment, and working with families through all their stages of recovery. This is a look at our care team. And you can kind of see the natural flow of OB services to moves on over to pediatric services. We have behavioral health, and the case management services is supporting outreach and the continuity of care for patients. And then we've recently added peer support. You want to do it?
We're all going to
It's
crowd
a
around
party
this
in
screen.
here.
It's easier.
And here we all are.
It's the care team and I'm not a care provider. And I'm going to pass this over to Sasha really quick, who is our Child and Family Services Manager, and she's going to give a quick overview of our family room.
Good afternoon, everyone. I just wanted to take a little time and talk about our family room and what an incredible, unique space that is that we have at Oasis. Not only do parents have the opportunity to have high quality child watch, as we call it, while they might be addressing medical or mental health concerns with our other staff. But it's really also a place that parents can come and interact with their children in a safe environment where they can play, and I can help them with any questions or concerns they might have about their child's behaviors, development, academics, things like that. And then we can go on to kind of dig into those topics a little more in depth. I've been fortunate enough to work with families and help with issues that they have navigating the public school system, to IEPs, IFSPs, potty training, tantrums, substance exposure, all of the above. So it's a really wonderful place to kind of bring families together and address multiple concerns that they might be having about their parenting and their child's development. And so with that, I will pass it back to you, Kristen.
Mm-hmm.
Thanks so much.
And Sasha is also able to do home visits and help people in their environment, which is really nice, particularly with more complex parenting challenges.
I have a question.
Uh-huh.
So if they aren't, if they need just services like for their kids, services that you can help them with, Sasha, can they be seen for that? Or can you refer them to that? Does that make sense?
Without being a patient here, you mean? Like they don't have to be here for primary care? We don't have to be there.
Could they? Yeah, exactly. Well,
We're not really set up for that yet, unfortunately.
Yeah, currently my services are available to patients who have already established care at Oasis.
So that's part of
Oh, you're breaking up, Alex. I can't really hear you.
That's what a lot of people have been asking. Is part of the little perks that the Oasis comes with, right? Well, can I have this without that? You know, so this is good to know.
Yeah, and we hope that in the future, another part of my role that I'll be able to do is go into the community and offer trainings on child development, coaching parents, and also working with children and families who are experiencing substance use disorders. So that is kind of something that we're looking forward to in the future, is making those community connections where I can kind of get loaned out. So.
And if you have specific people you really think could benefit from Alex, just tell us.
Okay.
Just let us know. So we do medication-assisted treatment. We do a lot of buprenorphine. We're also able to do Sublocade for patients, which is the injectable once a month buprenorphine, which is a great option for a lot of people who really can't stay stable on their oral medications. We also do medication-assisted treatment for alcohol use disorder, Vivitrol, and other medications we use with that. We have the full range of primary care that we do here. We now have a pediatric nurse practitioner, so we can do full pediatric care as well. Hillary, who is our prenatal care provider. This is a program we're really building now, and we have 30 women in the program doing combined prenatal care, postnatal follow-up or postpartum follow-up, and combining that with a support for addictions treatment. We have a mental health therapist who is with us who can do either shorter sessions like integrated behavioral health or do ongoing mental health therapy and also couples counseling, which is really great. That has been a barrier for a lot of patients as they're transitioning from their life in use to recovery, kind of getting to know each other again and really establishing good communication. So that's been really invaluable to have her on board. With care coordination, and our multidisciplinary team is for patients who have what we call high systems involvement. So they have involvement with community justice and self-sufficiency and child welfare. And that's a voluntary program for patients. It's based on the family court model, but the idea is to have all of your different services on the same page. So that group meets weekly to discuss patients with where they are sort of in their plan of care and progress. And then they meet with the patient and family once a month to review that. So this is just a little kind of schemata. We also have resources. We have a small clothing closet, food available, diapers, some basic needs for patients in the moment, small allotments of gift cards if people need it for gas or that sort of thing. And so I wanted to do just a little bit of kind of overview of our philosophy and some quotes and thoughts that have influenced me a lot in caring for people with addiction. So I'll just read this quote. The brain regions and neural processes that underlie addiction overlap extensively with those that support cognitive functions, including learning, memory, and reasoning. From a psychological and neurological perspective, addiction is a disorder of altered cognition. And I think that's something that's really important to keep in mind as we're working with people who are active in their use or who are in early recovery. They're not fully in their frontal lobe. And so some of the things that we ask them to do and the requirements that we have, they're not quite able to get there. And really, if we want to meet people where we're at, we have to be conscious of that and say, okay, what's this person capable of right now? And if they're not capable of more than that, I'm not going to ask them to do more than that. This is another, Bruce Perry has been very influential in my thinking. He's a child psychiatrist. But one of the things he talks about is that there's a neurosequential model to the brain. Basically, all the information you get from the outside world goes through your brainstem, your midbrain, your limbic system, before it reaches your thoughts. And one of his taglines is regulate, relate, reason. So I think one of the important things when we're dealing with people who are in crisis or who are heavy into their addiction is that if they're not regulated, if they're emotionally at a high pitch, we're not going to be able to do any of that cognitive planning. The first thing we have to do is to get that person feel like they're down a notch, they're regulated, and they're safe. Then we can start to do some of the planning. But without that, then, you know, we're just kind of throwing words at them. And that's usually not very helpful. This is sort of another slide from Bruce Perry, but also talking about basically when people are dysregulated. And I think this is also when they're in their use. You know, we talk about use putting us into our survival brain, that literally your brain can't think about the future. I think we all know this from either having started with addictions ourselves or working with people with addiction. That time frame of right now overrides anything, right? I'm going to get clean, but I'm doing it tomorrow. I swear to God, today is my last use. Tomorrow it's going to be different, right? Because they're so in the moment. So that's an important thing to think about when we're dealing with people. You know, and that's one of the reasons why we really try and work people in on the same day when they're ready for help or get them care as soon as they get it, as they can. Because if they're in that moment when they can accept help, tomorrow might be different. So it's really important to respond to people where they're at. And then this is just, this is a model we use for our MDT about just how complicated it is for people in early recovery to manage all of the things on their plate. They've got their doctor's appointments. They don't have a car to get transportation. They have to sign up for self-sufficiency and find housing. And they're dealing with their child welfare worker and finding childcare. So it's really tough and confusing. And the more we can do to kind of help people break that down into bite-sized chunks that they can manage, the better off they are. And so that's one of the things with our Oasis multidisciplinary team is really trying to break things down to make it clear. You know, what is that SMART goals? Whatever that acronym stands for. Somebody else probably knows. But basically, like, clear, obtainable goals that you can get to step by step. And that's one of the things we really try to work on, because that's how people build self-confidence too. And I think, as we know, you can't sustain recovery unless you have some faith in yourself. Yeah, Renee, you want to take over from this?
Hi, everybody. So right now on our multidisciplinary team, we have about 15 families. And with those 15 families, they're all signing on as they want to sign on. They're making the obtainable goals that they want to make for themselves. We kind of start out with an application process, and then the whole team goes over this application. And in the application, they're like writing down some of the goals that they want to accomplish, in the next 6 months. And we're helping them obtain the goals with them really doing the work, but they don't realize that they're the ones doing the work. And it's really nice. And I think part that they forgot to say on the multidisciplinary team is that we don't only have child welfare and community justice. We have the treatment providers. We have ARC and On Track as well on there, which has been a huge help with whether it's that they're struggling getting to their treatment appointment or they're struggling while they're in residential. We just kind of, as the team, we all get to talk about them every week and help come up with some solution bases for them in their scenario. We've had about 20 families, I think, graduated out of the multidisciplinary team since we opened it. And it's been pretty successful, and people hear more about it, and they're really wanting to get involved with it. And I think right now it's really a nice resource for them since community family court shut down, because it's a lot like community family court, excluding there's not a judge and you're not going to jail if you don't do something you're supposed to. So it's been a great opportunity for our participants, and it's nice because not everybody goes away at the same time. All of us kind of stagger out them getting out of their lives, and then they keep Dr. Hecox the whole time. So it's just been really wonderful coordination for the patients.
And Renee is our multidisciplinary team coordinator. Extraordinary. And I'm going to pass this on to Hillary Handelsman, who is our prenatal provider. The program that I've been talking about each month for the whole year is now happening, and Hillary is going to share some information about Nurture Oregon.
Thank you. I'm so happy to meet all of you. And it's great to be a part of the Oasis team. We're really excited about our prenatal program. I just want to give a little background on the Nurture Oregon title. You've maybe heard about programs up in Portland called Project Nurture. Project Nurture is a really successful integrated model at 3 sites up in Portland, where they have integrated substance use treatment and prenatal care and provided that kind of wraparound support. And they've provided some funding for us to do basically a branch of that program here in Southern Oregon, and they're calling that Nurture Oregon. So there are different sites throughout Oregon that are trying to replicate some of the success of the Project Nurture model up in Portland. And we are doing that for the Southern Oregon community here. And it's really exciting to be able to see women find their prenatal home with us. I've done prenatal care in different, more traditional settings where their substance use kind of just takes, it's like number 5 on their problem list, right next to their eczema. It's just one of the things on their list. And I think that's a really difficult way to view a substance use disorder, because in their life, it's not just one of the side topics. When their use disorder becomes severe enough, it really takes center stage in what the focus is of the way their time is being spent, their money is being spent, their energy is being spent. It really takes the center stage in all of the stories, right? And so being able to place it at the center of their care has really created much more engagement than I've been able to see in any of the other prenatal care environments that I've worked in and supported women with substance use. because we're able to frame everything within the context of that being a safe topic on the table, like the lens we look through all the time. And it's been a really helpful way to create a feeling of safety inside of the walls of the building. So every family that is served here knows that they're safe to be very honest and open about their substance use and where they are with that. And I think that that has been a really special and unique thing for me here in the level of honesty and openness that people are able to bring forward into their prenatal care work. So our goal is to engage at any stage that they're ready to engage in their pregnancy. And so we have women who, come in really early in care and women who come in very late. And the goal is just to try to meet them where they are and to meet as many of the needs as they're ready to work on. Jill is peer support, and I'm going to let her just talk a little bit about her role in this program, because Jill and I work really tightly together with every single prenatal patient, and we do our visits together. And instead of them just seeing me, just seeing a provider, they really get to interact with a team. And so let me let Jill share a little bit about the role of the peer in this work.
So I am peer support here at Oasis, and like Hillary said, I meet with all of the OB patients with her initially. As peer support, I kind of strive to just empower women by sharing my personal experience, not only with my addiction, but also with my personal experience with Oasis. I was a client here at Oasis, and I was 2 months pregnant with my son when I came in. And I think a lot of women just come in kind of nervous about mat therapy or, just making a big life change. And I'm living proof that this program works. And I think just being there with them is helpful. I try to stay in contact with these women on a daily basis. A lot of our pregnant women right now are out in the community. And so going to get them, bringing them to their appointments, making sure they have lunch every once in a while. And we also just created an action plan packet that kind of intertwines what DHS is kind of looking for on an individual basis, along with what their goals are and what their strengths are, and just working on that, like side by side, step by step, meeting them where they're at and walking that path with them.
Thanks, Jill.
Yeah.
It's been such an exciting thing to have such a strong peer presence in our visits, because the women really just relax into the comfort of knowing that somebody fully understands the struggle of this journey, and the lack of the lack of judgment is really becomes human, right? And we get to say, like, really, this is really a safe place. And we really are wanting to help you in practical and real ways all the way through. So Jill gets to go out and meet people where they are in the community. And whenever they're reaching out for help, she can physically go to them instead of them having to physically come to us. And that's made just such an impact. I'm really grateful for that partnership. And so it's been a really exciting start to the journey. As Carrie said, we have about 30 women that are somewhere in that pregnant or postpartum phase for our first 5 months of work in the program. And we're running groups that are just starting virtually tomorrow. We were doing groups in person for pregnancy and postpartum care, not for their care, but as just an adjunct to their care to provide support and education and build healthy relationships around this time. And it was really fun to do it in person. And then with the COVID surge, we've needed to take a break, and now we're restarting virtually tomorrow. So we'll be offering prenatal postpartum groups and also mental health groups for women that are pregnant and parenting. And then Sasha will be doing a parenting group for women, for families that have children older than 3 months, all the way up to 18 years. So we're hoping to bring people into that virtual kind of room together and work on building community and support that way too. It builds a lot of momentum to be working on this with others. So it's very exciting. Are there any questions about the prenatal program or what we've shared so far today?
Do you have capacity to grow more, or are you reaching sort of a limit of how many folks you can treat?
No, I think we have lots of capacity. Our prenatal program has lots of room to grow. And one nice thing about our small-ish numbers is that we get to provide, long and quality visits. And I'm hoping we will just continue to be able to provide that even as our numbers grow, because often women come in, like Carrie was describing, when they're ready to change, we want to jump on that, and spend the time and put in the energy and the effort that same day to capture that moment of readiness. So we do try to put a lot of quality time and energy into each visit. Often prenatal care visits are like 10, 15, 20 minutes, and we typically spend an hour in a visit. And so we get to dig in deep into people's lives, their relationships, what they're really going through. And I hope we'll be able to maintain that quality even as our capacity expands. But we definitely have space. We're new. And so we hope that every woman in the area who has a substance use disorder and is pregnant will find us, because we think that we really are able to help them feel like they found a home to carry them through a super challenging and difficult transition time in their life.
Great.
So if anybody has any follow-up questions, feel free to let us know. This is our phone number for referrals, and then we're also on Unitas and Reliance for any referrals. And we can also do prenatal care meet and greets. Folks can come down and check us out. So if anybody wants to come down into our Oasis, we absolutely welcome you to, and just really appreciate the opportunity to.
I have a question.
Yeah.
Are you guys still only taking families for 6 and under, or how is that working now that you're expanding? Are you guys taking people across the board now? How is that working?
Yeah, thanks. That's a really great question. So our primary population is parents or pregnant women with substance use disorders who have a kiddo under the age of 6, but we also do see parents with substance use disorders and other folks. So if there's somebody who's interested, feel free to send a referral and we'll see if this is a good fit. But we do focus on that primary population just because of all the developmental opportunities and the really key point in children's lives to make an impact there. So thank you. That's a great question.
And you take all forms of insurance, including
Yes.
OHD? Great.
Great question. Yeah, so we do, and we also have a sliding fee scale and accept insurance.
Well, thank you all so much for being willing to come and present to us today. Tira Hubbard's on this call, so I'll embarrass her a little bit, but she used to talk about when she was working with women who were in the criminal justice system and she would refer them to a place in the community. It was so important for her that when she sent them somewhere, they were treated well and as people of value. And there's just no doubt that when a person walks into the door at Oasis, they're immediately treated with dignity, kindness, and as a person of value and worth. And I think that alone, in addition to the top-notch care, which is important, is one of the key things you guys do. So it's just so neat to see. And I'm really excited that our community has this. So
Thank you, Eric. That's definitely what we're trying to accomplish here. So.
All right. So after our presentation, we were going to look at local treatment provider updates. And I feel like I was out at the last one. So I look forward to hearing what everybody's been up to. And we had Leaf from Oxford House had to leave us a little early. But we also have Rogue Retreat here as represented by Alex Spray. So how's that, Alex? I'll just go right off the bat and see if you have any updates from Rogue Retreat that you'd like to share as we get into this list.
I figured that you would call on me first and pick on me first. I knew that was going to happen, but yeah, so we do have some updates. I don't know. This is my first time around, so bear with me. I got told that I was covering for Justin like last minute, but we are open. 2.0 is open, so I don't know if everybody knows that or not, but we have expanded and 2.0 is now open. The only way that anybody can get any, any guest or any individual can get over to 2.0 is through our initial one, the initial campground at 1.0. So you have to still go either through the livability team or the main office, or call Justin Barrett. We have so many Justins, it's unreal, but the campground manager is Justin Barrett. So we have, right now, we only have one open spot as of this second, one open tent spot. And we have like 10 emergency beds. We can expand to 10 emergency beds over at 1.0, but yeah, so we're doing great over here. That's actually where I'm at, is my office. I actually have an office. I was just promoted to the case manager. So we have 10 or 11, I believe it's 11 people over at 2.0 right now. So what 2.0 is, if anybody doesn't know, is the Kelly shelter. We run it like the Kelly shelter, but it's outdoors and in pallet houses. So we're waiting on we have 23 total pallet shelters right now, and we're waiting on 10 more. We'll have some rigid tents coming. And we're saving some to keep open because I don't know what we plan on doing with them. So, but we have, we're at max capacity at both places right now, but yeah, we're doing great. It's pretty cool to be a part of,
Alex, you've been helping drive this. Yeah, go ahead. But just the idea that we have access and support, low barrier supported housing in our community with the level that you're providing is really exciting. And that has gone up quickly, but yet safely and with a lot of thought towards how it should be. So,
anybody have questions about it? I mean, I probably didn't explain it very well, but.
No, that was
what are
great.
you laughing at, Renee?
Yeah, Jill and Renee seem to be having a good time today. Alex, I want to thank you for presenting on short notice. We've talked about you and your work in this community for quite a while in this room, and just thank you for all that you do and have been doing for quite a while. So awesome. All right, well, we'll go just down the list, and I know Kim and Nathan are here from the Addictions Recovery Center, so updates from the ARC.
Thanks, Eric. So some of you may know we had to collapse our residential facilities 2 weeks ago. We had gender-specific male residential treatment, gender-specific female treatment. We had to collapse those back into our West Main campus, and so we are now offering co-gender residential treatment. We hope this is a short-lived situation. It's really as a result from COVID and Delta variant and an increase in cases in our community, and also the vaccine mandate. We're really just trying to figure out staffing patterns and stuff like that. So what happened is we have the women have moved back over to West Main into Mason House, and we've lost one capacity to serve one female in residential, the capacity we lost the capacity to serve 4 men, and so we have 8 female beds and 11 male beds, I believe, right now. Detox is also operating at a reduced census of 6 due to staffing as well. We are working on recruiting all the time to try to get our staffing back up, get those residential units re-separated quickly, and our detox back up to 8 beds or so while we're in COVID. Also, we are recruiting to expand our community engagement services with our certified recovery mentors. That's a ongoing process. And we're also working with Jackson County Mental Health and several other organizations on the Community Response Network. And that's been a very fun process. And I don't think I have any other updates right now, Director Geyer.
Thank you, Clinical Director Olson. Very helpful. And I'm glad that, the residential services have been able to survive even through this. And hopefully, again, they'll be able to grow back up and get back to full capacity as we get through the pandemic. Jody, I heard you were on this call from Allied. So update on Allied.
Hi, thank you. Yeah, so I think the biggest update is, I don't know if everybody knows, but we did change our name. So we're now Medford Comprehensive Treatment Center. I would say that would be the biggest update I have. Other than that, we were able to get some new counselors and just been staying busy.
That's a great update. So MCTC, Medford Comprehensive Treatment Center, formerly Allied. Same location?
Yes.
Okay.
Yes, same location and all of that. It was just a name change, yes.
Excellent. All right, I didn't know that, so that's a good update. I appreciate it.
Yeah.
All right, thanks, Jody.
Thank you.
Yeah. Boulder Care. Is Boulder Care here with us today? Not today. Dane, I saw Dane from HIV Alliance.
Good afternoon, everybody. We're doing well with Naloxone in Jackson and Josephine. I think we did 20 new clients in Jackson last month, 25 refill clients. That's where we gather most of our data. 188 doses, 11 reversals. So actually 44% of our clients that refilled, it was because they used it to reverse an overdose, which I think is pretty incredible. Then Josephine, we had 77 new clients, 32 refill clients, about 144 doses, 14 reversals that were done in Josephine County. So 43% of the reason why they refilled the kit was because of a reversal. So carrying naloxone saves lives and it works and everybody needs it. And you can get it from HIV Alliance or you can get it any pharmacy in the state of Oregon. And I encourage that, have that conversation with every pharmacist if you go in and pick up another prescription, because I have heard recently a few barriers with some certain pharmacies not wanting to refill, giving a little hassle on insurance. So I think that helps us head off issues and brings awareness. So if you're picking up another prescription, just talk to your pharmacist about naloxone and ask them those questions. Go, hey, how often do you fill these? How many times do people ask? And, even check the price of your own prescription, have them run it through and they'll tell you a price. And that's how I know last year was $1,250 on our Providence insurance. So really good deal, easy way to get naloxone. So I think that education and making sure people carry it, it saves life. And just think what we could do if everybody had naloxone. So have a great day. I appreciate everybody that's on here.
Dane, thank you very much for the update. And Tira Hubbard put in the notes there a link to the Association for Justice Involved Females and Organizations. And as I look at all the different squares within this meeting, almost everyone here has had an impact or has worked with Justice Involved Females. So again, there's that link to that in the side. Copia, Cynthia.
No updates from Copia.
All right. Thanks, Cynthia. Are you seeing folks on your in your Medford office on East Main?
We are, we're not doing our counseling services in person. We're back to all telehealth right now. So we went back to in person for a little while, back to telehealth. But for our DUI program, we're doing UAs there and stuff like that. So clients can come to the Medford office to get their, to do their UAs and stuff. So yes, technically yes, in some capacity.
Great though. I like the fact that it is expanding and again, soon, perhaps soon. So great. All right, Sarah, you still get listed next to La Clinica. Is that okay? Do you have our La Clinica update?
I do. I'm sitting here in Birch Grove Health Center. And when I was thinking about what to say, I thought about the fact that we're able to keep expanding the number of providers who provide medication-assisted treatment, the X-waiver buprenorphine treatment. I think here at Birch Grove, we have all 4 providers do that, and we have at least 90 patients here in this one clinic alone. And then, of course, there's at least 15 others in La Clinica who offer that service. And it's really important to us that we do that. And people may want to do that in a primary care setting. So we're really up for that. Since March, basically through Birch Grove, we've gotten 520 doses of naloxone into our community. And we continue to do that. The Measure 110 funding should be able to help us keep doing that. Also, we have 2 pharmacies, one at the Wellness Center, which is next door to Medford Treatment Center, and one in Phoenix. So they also can offer, I'll say, like non-stigmatizing opportunities to fill medications, and we do provide naloxone there. We have some federal funding, a special type of stream, so some things can be less expensive there. I think that's it.
And that's a really good update. I mean, you think back to 10 years ago and what the attitudes about many, including me, were, and the understanding of MAT, and just the fact that it's being integrated so fully into the care we provide in our community, and how we've learned, and how it's like, yeah, of course you have 4 people that are doing, these number of people. And I just like that our community norms and understandings have changed towards one of health and safety, and in terms of this intervention. So very cool to hear, Sarah.
Yeah.
Is Julia here from Max's Mission?
She is not. They have an event today. She sent me a message, and I don't speak for her exactly, but I just want to share that there have been so many overdoses and reversals. I see Dane nodding his head, that it's really like a crisis situation. So they're out there getting more naloxone into the community, but she reported quite a few overdoses in Jackson, Josephine, and probably Klamath, because I know they do something over there. So yeah, it's just really important to make sure that you have naloxone.
I saw her today at Hawthorne Park, at the Pathfinder event, and they were getting naloxone into the community. And she was very gracious, and she said, Eric, will you be able to help and maybe present at our presentation or when we have our overdose awareness day in October? And I said, yes, of course. And I appreciate her asking me, because she could just tell me. And I mean, when it's Julie, I think we would all just say yes. So the fact that she still asks, I said, that's nice of you, because I'm going to say yes no matter what you really bring to me. So their work is so important, along with HIV Alliance, as we look to do this work. Medford Treatment Center, do we have Kyle or Joanna here today?
I'm actually Lainey. I'm the
Lainey.
nursing supervisor. Yeah, I'm representing Medford Treatment Center today. We don't have any updates this month, but I did want to introduce myself. I'll be attending meetings once every 3 months.
Nice to meet you, Lainey. Really glad you could make it. So
Thank you.
And we had our presentation from Oasis, and I realized there's confidentiality in HIPAA, so we don't get to actually see baby pictures. But deep down, I'm kind of, baby moments would be nice, but I respect the fact that we need to respect that. So, all right. And on track, Eddie.
Hi, everybody. I think right after last month's meeting, we were able to announce that we got this federal grant to start a training program, which was really great, and also a big holy SH asterisk T moment. We were like, oh, you're kidding, we got it? Wow. So we're starting a training program called On Pace. Hopefully we'll be able to make a dent in the just tragic staffing shortage in our fields, so we can help more people. So we're sort of slowly lifting it off the ground, and maybe at a future meeting, I don't really know how to get on the schedule to present, but maybe I'll talk to Stacy and Eric about maybe I could present about the On Pace program and just give you the basics. We've got a cohort starting in the fall, and again in the spring. It's a part work experience, part classroom experience, and I'll have more information. And Summer just wanted me to say that the classes would probably start just after the new year, and hopefully we open them up to the community, to people who need CEUs and all the stuff, the classwork involved in getting a KDAC. So happy to provide more information. And other than that, in the more immediate sense, echoing what Nathan was saying, staffing, still stumbling along. Would love to find some mysterious group of people that loves to work a graveyard shift in residential. And where is that group? Are they out on the?
I think Commissioner Dyer is volunteering.
Oh,
Commissioner,
cool.
you have a question? Oh.
Yes, I do. Yeah, I'm always awake at that time. Sure, I'll come down. No, I hear obviously a lot of concerns about staffing, which is pretty pervasive throughout most workforce industry right now. But is there any anticipation from the local providers, any sense of how much more, if any, you may lose due to the vaccine mandates, and what kind of resulting loss in service capacity that might be a consequence of that? Is there any sense that anybody would like to share?
I can offer up that we have roughly 100 staff at any given time, and it's looking like about 8 to 10 folks we may lose. And that's across almost every department, from facilities to admin to support staff. But we're hoping as the deadline gets closer, maybe some people will be moved to get vaccine.
Right. And from ARC's perspective, in outpatient, we're not going to be losing any CRMs, certified recovery mentors, or counselors. We did lose one mental health therapist a few weeks ago, and have been able to cover most of her active caseload. And then in residential, we're looking at losing probably 4-ish people, maybe. Kim might have better numbers than that, though.
I think total at the ARC, we're probably around 6. Yeah, across the board, something like that.
We're much smaller comparatively. We're just outpatient at Copia. We're less than 10 employees total, but we're not losing anybody. Thank goodness.
Good. I appreciate it. It sounds like it's not going to be terribly, although I'm sure any losses are really difficult right now. So I appreciate the info, though.
No, very good question, Commissioner. Thank you. And I don't mean to catastrophize it, but really on the state level, and as we feel it locally, the loss of people willing to do SUD-based peer work and clinical work is just really exacerbating the problems we're seeing with overdoses and people who are being harmed. So it's really at a crisis level in terms of how we can get our staffing levels up. And that grant that Eddie's talking about, I think would be very timely to hear about, because it may be something that could help impact that over time. So.
Hey, Eddie, can you and I connect offline around your contracts training program? I have some questions and thoughts and would like more information. Thanks.
Awesome. All right, Phoenix, do we have a representative from Phoenix here? Didn't see that. And then Recovery Cafe, Reclaiming Lives. Not seeing Recovery Cafe either. Well, let's see, OHA or Oregon Recovers. Do either of those entities have a representative here today?
Don't skip CCOs.
I totally skipped CCOs. Thank you, Stacy. Well, let's go back because I know our CCOs are present. In fact, I saw Jeffrey here earlier. So Jeffrey, if you want to start us off on CCO updates.
Hey, Eric. Hey, everybody. Good afternoon. Hope everybody's doing well and enjoying the blue skies and, breathable air. It's pretty amazing out there right now. Yeah, I don't have a ton of updates. I think I just wanted to follow up on a conversation that we were having at the last meeting regarding naloxone access at the emergency department upon discharge. So I've had the chance to follow up with Sarah Smith from La Clinica. I talked to Mark Cantor, one of our pharmacists at All Care, And Mark and I have reached out to a couple of contacts at both Providence and Asante to learn a little bit more about their procedures when it comes to naloxone at the time of discharge, just to see if there's any possibility of removing any barriers or hoops to jump through in regards to actually walking out of the ED with naloxone versus walking out with a prescription only. So just trying to make it as easy as possible. I've had a chance to catch up via email with Dr. Kelleher, the Emergency Services Medical Director at Asante, and we're still kind of in communication around that. As you can imagine, Asante is pretty busy at the moment with a lot of things, and so changing procedures at this time might be a little bit difficult, but it's on the radar screen and conversations are being had. And as the CCOs, we're willing to do just about anything we can to assist in this way. So just wanted to provide that update. And I think that's all. I think that's all I have right now. Thank you.
Jeffrey, thank you. And thank you for following up with the emergency room response from Asante. I think that's a really important thing. And it also means a lot, I think, to this group that you were able to carry that concern up the chain like that. So thank you.
You bet. Thank you.
Great. Julia from Jackson Care.
Yeah. Hi, everybody. I also, I would echo with just the fact that I think the CCOs are trying to support providers with acknowledging the overwhelming administrative burden that's going on right now. And so we've paused a lot of more intensive project work or metric focus. And we're just looking for ways to help with like immediate capacity needs or stay abreast of capacity issues so that we can support our members with access. We're going to be dispersing some funds across our physical health, our hospital partners, and as well as our residential providers, basically staff who are at facilities for extended shifts. We're looking at sending like food and just kudos in the form of treats and things that we can that we've pulled together, like massage certificates, things like that we can just show our appreciation and acknowledgement for staff who are putting themselves at a higher risk being in those types of settings, and just the emotional drain of the polarization that's happening in our community, and unfortunately how that's really coming down on our physical health providers. So we're trying to show praise and appreciation where we can. But I would say that's really the update that I have at this time. So thanks, Eric.
I think that's a really important message, Julia, and it's great to hear, just considering how much people have been under, particularly people who are doing human service and healthcare in this time. So thank you for that update and that work.
Oh, and I'm sorry, Eric, one more thing. I forgot to add, because we haven't heard back yet. OHA was going to make the announcement on who the recipients were for the Behavioral Health Planning Grant Award. So that was $50,000 to support planning efforts that ideally would come up with a plan for like a brick and mortar stins to housing need folks with mental health and substance use who are in marginalized population groups, the needs that they have. And so I know that there were several entities that applied in our region, and I don't know who those entities are necessarily. All of them. I know we were one entity, and I know Compass House applied under the larger umbrella, but I think there were like 6 or 7 groups that applied. And I have also heard rumor at OHA that they're planning on accepting all proposals, and I don't think that they're planning on denying any of them. There hasn't been a formal announcement made. It was supposed to go out on the 17th, which was last Friday. So hopefully we'll hear about that. That will help, support planning efforts for what's going to be coming out in December, which is the real RFP for a plan, for spending down the very substantial amount of money that could go towards housing folks in crisis. So I just wanted to, I don't know if anyone else has heard an update on that, but so far no news yet.
No, and I'm curious, a timeline on that would be exciting. And then identifying those entities in the South here and coordinating, hopefully, what that looks like. Coordinating the coordination.
Yeah.
So.
Yeah.
All right. Well, thank you for that, Julia. Let's see. Oregon Pain Guidance and Naloxone Work Group. Sarah, did you already get us? I know you were talking about La Clinica, but.
Yeah, I have a couple other things that I think people might be interested in. One of them is that I learned a word this week, I think from Oregon Recovers, but it's called a syndemic. So what it means is that there are other epidemics occurring alongside the COVID epidemic, in particular, an overdose epidemic. So in Mike Marshall's, it was kind of a petition that you may have seen from Oregon Recovers, but they said that tracking data that there had actually been slightly more deaths due to drug and alcohol use than there were COVID in 1 year in Oregon, which to me is pretty startling. And I keep my eyes on that quite a bit. So, and then just to kind of go with what Jeffrey was sharing with us, there's a pharmacist at Providence, I think her name is Micah Michaels, and they have taken on the project of getting naloxone out to people who've been hospitalized. That is somewhat easier than the ED right now for reasons other people have shared about structure and so forth, but they are interested in doing that. So that's kind of a breakthrough from my perspective. So, and that's it, that's all.
Those are exciting and, well, sobering and exciting and important. So thank you for sharing that, Sarah. Dr. Trott, I don't believe is here today. I haven't seen him.
Hey,
Justin,
Eric,
oh yeah.
Can I just chime in on something Julia was saying? And that is just, I wanted to remind this group that it's been a while, but we had Angela Warren come to talk about the CHIP and the CHA, the Community Health Improvement Plan. And I just wanted to remind people as we were talking about these housing things that the 3 priorities for our county have already been identified, which are behavioral health, which includes both mental health and substance abuse, as well as housing and as well as parenting and family matters. So just to plug in that if we get these dollars, it really will be able to maybe help us take the planning and the coordination to a different level. Not that we need to spend a lot of time assessing what we need, because we have spent a lot of time already doing that. So I just wanted to remind people about that conversation we had.
Thank you. I appreciate that. Justin from Boulder. Justin, did you want to share about any updates about Boulder?
Hey everybody, I've been bouncing in and out, so I apologize for not being here the whole time. Yes, other than to say hello, and also I don't know if I brought this up recently, but we do also do alcohol use disorder. So we are not just only OUD. So just so that word is out there. And then also just a little plug is that Boulder is a non-punitive treatment, meaning that we do that if someone is a patient with us, that if they test positive for a drug test and they test positive for methamphetamine or marijuana, they're not kicked out of the program, that we continue to give them service, which is different than some places. And so just to make sure I make that distinction for y'all. And yeah, thanks for letting me talk for a second. Thanks, Eric.
No, it's always good. I think one of the things we do here is just connect, but thank you for informing about alcohol use disorder and the nature of the way you guys provide services. It's very helpful. So,
thanks.
Great. And Dr. Mann, not to put you on the spot, but I see that you were able to join us today. Do you want to give us any updates about your work?
I don't have any exciting updates. We're just continue to plug along here at Jackson County Mental Health. I continue the monthly Southern Oregon Addiction Medicine Journal Club. Another round of ambulatory substance use disorder treatment, Cco, has started. I'm on faculty for that. It's exciting for anyone who can join on Tuesdays at noon. We've just started a new course of that. We just had our second session yesterday. We just continue to do a small amount of dual diagnosis treatment as part of our larger mental health treatment. But thanks for checking in. Good to hear everybody. And everyone's doing such good work. So exciting to hear what Oasis is up to. You're doing great work over there.
It is so cool to see. I really, yeah. And again, not to harp on it, but I remember 10 years ago where we would hear MAT and we would get kind of like, whoa, or we would hear these kind of things. And then 5 years ago, well, maybe we should look at it. And now it becomes a community norm that people can provide this in ways that are very person-centered. And I think that's an exciting development in our county. So neat to see. So we will meet together in a month. If you would like to be an agenda presenter or you have ideas for presentations, please email myself or Stacy or Sarah Smith, and we would be happy to entertain those and see what we can do. This has always been about promoting and the ideas and work that get done in this community so that we can all be stronger together. And so I thank everybody for their work. And
hey, Eric, I just want to also plug, we do have some openings on this group. So if anybody who is a regular presenter or participant, if you're interested, please go online and fill out that application to be a member of the board if that's something you're interested in.
Great plug. Thanks, Stacy. Yes, there's space available. So for those who are wanting to do this work. All right. Well, we will conclude our meeting. I thank everyone for attending and participating, and have a good month.